What is up, everybody? Welcome back to another exciting episode of the Dentist Who Invest podcast. And I am sat across the Zoom table, if that is a thing, from an esteemed gentleman in the dental world who I know for a fact has a very good profile, and lots of people know about him because of his abilities in the dental world. But also, we're here to talk about his philosophy on accruing wealth, and it is a powerful message. It is a useful message. It is something that everybody needs to hear. And the gentleman I'm sat opposite, his name is Devang Patel, and I'm very pleased to have him on the show today to talk about what we're going to talk about. How are you, Devang?
I am very well, and thank you very much, James, for such a nice introduction, and thanks for inviting me here.
Oh, dude, my pleasure. Anytime. So, Dev, for people who are in the dental world who don't necessarily know yourself or who have yet to meet you or come across you, maybe it might be nice to do a little bit of an introduction just to explain who you are, what you do, and what we're here to talk about today.
So, hi everyone, I'm Devang Patel. I'm a restorative and implantologist. So, I do mainly full mouth reconstructions and all sorts of implant work, autogenous bone grafting, sinus lifts, full arch implants. And I see patients on a referral basis. I work in Devon and Letchworth, so two wide areas, and I live in London. So a lot of traveling, and that gives me a lot of time to ponder about, help other dentists, which I love to do. I also have been teaching at UCL at Eastman Dental Institute since 2011, 2012. So I teach and I work, a really good combination.
Awesome. And Dev, just to go back a little further, because I know your personal story, don't I? Because we're involved in a few circles together, which are somewhat related to dentistry, but also more on the business side. And you know what I think would be awesome to share? Do you know when you spoke about when you told your story on that course that day about how you came from India all the way over to the UK and you had to learn dentistry trial by fire effectively in the UK. I would love to hear that again because that was awesome. And I feel like there'll be lots of people out here in the audience who'll connect with you if they could hear that. Would you mind sharing that? Because I thought that was cool.
Sure, yeah. So I basically graduated in India, and in 2004, did my international qualifying examination. At that point, there were three parts. So I gave the examination, passed the exam, and started working in the UK in 2006 on the day when the UDA system was launched. So, I was the first, one of the first dentists who just started without knowing how the old system worked. Started UDA system. I used to do 9,000 UDAs and a year because it was a predominantly NHS practice, and worked for 6 years. And as everyone, does, I mean, I invested a lot. I did 2, 3 restorative certificate courses, did my MJDF, did other CPD events and courses. And ultimate goal was at that time to become a private dentist where I can just leave NHS and work into private practice. And I thought the only way to do that is to do masters or to become a specialist. I didn't have money to take 3 years of work and to become a specialist. So I decided to do next best thing, which is MSc in conservative dentistry from Eastman Dental Hospital. And that is a very unique program where you work as much as you want. The hospital was open for 7:30 in the morning till 11. And we treated our patients, but at the same time, we did all our own lab work. So if I prepare a crown, I would I would wax up the crown, cast the crown, polish, finish, porcelain, whatever, and then fit the crown in patient's mouth. So the whole circle is done by me. And it's a good thing because you get a lot of ideas as to where you're going wrong and why technicians not being able to give you a good quality work back. So I really worked hard. I worked there. I used to be there every day in the morning, 7:30 and 11 o'clock. I would go out in the evening, including weekends. So I used to work 7 days. Patients only seen in the weekdays, but because you see patients, it create a lot of lab work, which we need to do. So I did that over the weekend, and did a lot of full mouth reconstructions. And that's when really I appreciated the value of mentoring, because I had all the knowledge. So I did all the courses and everything before. I had knowledge of full mouth reconstruction, but until someone sits next to you and, tells you what's going wrong with yourself, but with your technique, the way you're implementing what you know, it's very difficult to speed up your progress. So, I did a lot of implants. I restored implants, and it was very fun. Fun 1 year, hard work but fun. I was given Best Student of the Year prize. I passed with distinction, and it was really good, and I really enjoyed it. So when I came out, I thought, okay, you know what? I am on the top of the world. People will be lining to, give me jobs, but unfortunately, that wasn't the case. I applied for a lot of jobs, didn't get any, because I guess I was in the middle. I wasn't specialist and I wasn't general dentist. So then I went back to my friend's practice. I did a couple of jobs in between, one day on a private practice here and there. Then I went back to my friend's practice, working in the National Health mixed dental practice, because I didn't have money again, because after finishing course, I was broke. The only thing I was doing is I was teaching, which I loved. So I was teaching at Eastman Dental Institute, MSc in Restorative Dental Practice Program dentist, and I was a program coordinator for that as well. And I was also deputy head examiner for ORE, which is similar to IQE exam. So tables were turned. One time I did IQ exam, and now I was the examiner for the same exam, which was a nerve-wracking experience. And I can see why people are so nervous, and I can relate to that environment really. All that, as you said, when I came to UK, I was struggling to speak, and my English wasn't very good. Not many people say that. Someone pointed out that it's not still good, so I'm still improving. But yeah, so going back to working, so my friend gave me a break in mixed practices, and I started working. He taught me really how to communicate with patients, and he gave me opportunity to go around his practices and see referral patients, and that's what I did. And since 2018 now, I'm just doing patients on a referral basis and doing complex cases, which is really good. And I think if I wouldn't have gone through that journey, I wouldn't have become the dentist I am, because throughout that, I did, after my MSc, I went to what he told me actually, which is very good. He's like, look, if you want to learn a skill, you need to learn from the best, who is the best. And it doesn't matter whether you have to go wherever you have to go, just go there and then learn from them. So I wanted to learn a Curie technique. So I went to Germany and learned from him. I went twice, because one time's not enough. So I went twice, and then one of his assistant professor was assisting me while I'm doing surgery. So I got one-to-one mentoring from him. I learned root canal treatment from John West, who invented pro taper files. So I went to San Francisco, did the course from him. I did perio course for implants from Otus and Herzler from Munich. So I went everywhere, did all the courses. So I felt, I'm a very good 360-degree dentist. And then after doing all dentistry, everything involving ortho, perio, endo, whatever you name it, I did everything, and I still do everything. But then I decided, okay, I want to now narrow down my skills. And then I chose to do just full mouth reconstructions and implants. And that's what I do now.
Wow. And to come from where you were, Deb, you're still only 39. That's the crazy thing. That sounds like the CV of someone who's 60. Are you with me? So fair play, and it just shows you, if you just double down on investing yourself, how far you can go in a certain, in that amount of time. And it's fair to say you came to England. It wasn't like you had a silver spoon in your mouth. There was a few times when money was tight and you still got to this position. So I think that's quite remarkable, really, and it goes to show that if you can excel and get to where you are, you personally, then that's inspiring for anybody. So yeah, awesome. And that's why I wanted to get you on the podcast, because platform is about investing, not just financially in the world outside of your own head, but also within your own head as well, because that knowledge and that investment also compounds. It just compounds in a different way, which leads very nicely on to what we were speaking about today, what we're going to speak about today, which is the 4 pillars of investment. And Dev and I were talking off camera just before this podcast happened about these 4 pillars of investment. And Dev has an amazing philosophy, which I really, really wanted to give a platform to and to share with the world, because I know that there'll be people out there listening today who it will ignite and who it will inspire. So therefore, Dev, I'm going to pass the mic over to you once more so that we can speak, or so that you may speak on the 4 pillars of philosophy, and you can share those with the audience, what they are, how they work, and how they've helped you.
Well, thank you very much, James, for again those kind words. And look, I'm not an investment guru. You are. So, but I have a different philosophy, and my investment philosophy is a little bit different. It's not about money. It's about people. So I've broken down investment levels into 4 levels: investing in yourself, investing for yourself, investing for others, and investing in others. So let me explain all these 4 pillars. So investing in yourself. So before you start investing anything, you need to really invest in yourself. You need to, and that's what I did. I can only relate to dentistry. So that's what I did in the beginning. I really invested. I spent, although I didn't have much money, I spent all what I had in courses and doing further education to grow myself, so that I'm capable to invest for myself. And when it comes to investing for myself, you can, you are the expert, you look into stocks, Bitcoin, different things, you can do that for you. Then you can invest for your family and friends. And then once you reach that level where you have invested for, others, you need to then start investing in others, which means, and that's what I've started doing now. So I've created a group called Full Mouth Reconstruction for GDPs on Facebook. That's where I share all the tricks and tips of full mouth reconstruction, because that's one way of me giving my time and my effort to the community back, and helping others one-to-one is another way. Because someone told me that let's say if you have a 50 billion pounds, and if you give 1 million pound as a charity, and if you have, let's say, 1.2 million pound, and if you give 1 million pound to charity, that's a huge difference, because you're short of something, you're still giving away. And for me, I sat down and I thought, you know what, what I am short of is time, but if I give away my time to someone, that's the best charity I can do. And that's selfless, because I really need my time, but I am giving it to someone else, and that's called investing in others. And you always start investing in yourself, because you can't reach level 4 until you finish your level 1, level 2, and you're comfortable with level 3, and then you do level 4, where you're investing in others because you have something to give back to community. And that's what I'm all about. So if any dentist trying to progress through the career, I would always advise them to invest in yourself, like I did, and it worked out okay for me. And sometimes it's hard. It's hard times, because usually when you're investing in yourself, money is tight, because you're not at that level, and you have doubts whether it's a good thing to do, or not. But whether it's a good investment or bad, if it's for yourself, within yourself, then it's always good investment, because you either learn or you succeed. So it's one way or the other. There is no failure, because even if it gets worse, you learn not to do things, how to not to do. It's a hard way to learn it, but it's one way to learn that thing. But yeah, so these are essentially 4 pillars of investing my way.
That's cool. You know what? Here's the thing about me. When I've done dipped in course, I've done a few other courses in dentistry, and I only ever did courses when someone else pushed me or coerced me into it. And if I would have just did it off my own back, I would have seen that knowledge compound so much more and so much sooner. And actually, that's something I want to touch on just super briefly. Because when I say knowledge compounds, what I mean is everybody knows in investing that when you invest, your money gradually grows until eventually it takes off exponentially. And knowledge is like that as well, because the simple stuff that you learn at the start, the more you learn and learn and learn, the more you connect the dots as time goes on. And actually, when it gets to the point that you're further down the line, you become the expert. Teeny little tiny bits of knowledge that you add on to your knowledge base, because you connect them with so many other individual parts of knowledge that you have prior to that point accumulated. What that means is that even adding one little tiny bit of information means that you gain exponentially more than the next person, because you've already studied that in depth. And that's something I really like. Is that something you've come across, Dev? It's an interesting way of looking at it.
It is very interesting way to look at it. I haven't come across it, but I can completely relate to that, because it just compiles and you think, I'm doing all this, I'm doing all the time, all this, and when the dot's going to connect. But as someone said, the dot always connects in the past. You cannot connect dots in the future, right? So now the dots are connecting. I've spent all that time, although I don't do endo anymore. I still have the knowledge. The other day I went, one of the associate came back and like she's stuck with the root canal, and I just went there and opened the canal for her. So it's in the molar. So it's I still feel that I got it, and it's good to know that I can help someone with those skills.
Yeah. And yeah, awesome, brilliant, top stuff. And then, like as I was saying just a second ago, as well, in addition to that, I only ever pursued these courses. I only ever did them if my principal or somebody else said to me, James, you have to do it. That's the point in you being here. I never really did it off my own back. Okay. Now, some people will be listening to this and they'll be, they mightn't have that outside influence who's pushing them in the right direction. Those people who need to be inspired to go and learn, if you could go back and speak to a young, well, actually, no, let me rephrase that, because younger Dev had this already, so he didn't need anybody to have words with him. But let's imagine there's somebody out there today and they need a little bit of coercion to start investing themselves to do dental courses. What would you say to those people? What are you seeing having come out the other side that they're not necessarily seeing? Try to put yourself in their shoes.
I think, James, what it does is that it opens up many doors. So, if I want to invest now, if I want a new loops, I don't have to think about money. If I want to invest into, all my investment is dentistry related. Unfortunately, I'm sad. But if I want to go away, which, I mean, I'm not a holiday person, but let's say if I want to go away, I won't have to think about money yet. So with investing in yourself and doing those courses and everything, if you're planning to do dentistry for long term, obviously, I think it's good for your patients, and it's patient deserves best from ourselves. But B, it will give you that flexibility to do quality dentistry, because I see many dentists who don't like dentistry, or they're frustrated. It's not because they don't like dentistry or they're frustrated with dentistry. Many times they're frustrated with the system. They're frustrated with the environment they're in. They're frustrated with the mundane work day in, day out. They could just go clean the teeth, do the filling. So for me, whenever I get bored, I go and do another course, because I always learn something new and it just keeps me going. And so people who are really thinking about whether to invest in courses or not, I would look into doing it like two reasons. One is just to keep the dentistry, spiced up. So you learn something new, you get excited, you come back and, book another course, maybe a couple of months or a few months later, straight away. So you look forward to that course. There's something professionally you improving on. And also it gives you another vehicle to fulfill your other needs. When you do the courses, obviously you improve your quality of dentistry, and inevitably you get remunerated for that. And with that, you can spend that on things what you need, and you get less stress because of that. So two ways, yeah. So for me, it's more motivational thing as well as generating income.
Yeah, 110%. Well, there's a saying that I love, and it is, you don't know what you don't know. You literally cannot fathom what is outside of your head, what information is out there until you begin to learn about it. And, I see so many, I think that it's common in dentistry that people feel stuck in a rut in their career. And the thing about dentistry is, it always blew my mind. We're talking about from here to here, so from the base of your nose to the bottom of your chin and what's inside your mouth. Yet there is just so much stuff out there. Like the amount of information just is unending and complex, and there's so much to it. So there's always going to be more to learn. So I suppose it's about rolling the dice, immersing yourself in that environment where you feel like there's going to be something that's going to bring another dimension to it, and then implementing it in your dentistry itself. And I used to get really excited when I learned something from another course, because I could take it and I could implement it the next day. And that was the cool thing about dentistry. And we've also said the E word a few times, exciting. That's what life should be about. Before it's money, before it's anything else, we've only got so much time on this earth. Every moment that we spend not being excited and not having fun is time that we don't get back. There's no rehearsals in this life, and that in itself is a reason in essence for me to do that, even on its own, even before we talk about anything else. And I just think that's a really nice way of looking at things, and that's my philosophy as well. So Dev, you spoke about learning, you spoke about dentists, you spoke about your own path, and also what route you went down and all the courses that you've done and all the rest. Let's say in the audience, you also own practices as well. So there'll be some dentists out there who are thinking about taking the leap to own their own practice. Where would you?
I don't own practice. I'm an associate. I visit practices. Sorry.
Sorry.
Practice I feel that if I would have owned the practice, maybe I wouldn't have been able to do progression in this way, because my progress is very focused on educating myself, developing skills. I have not invested anything into business or time, money, anything. All my investment went into improving my skills and getting better at it and practicing those skills. And I feel that maybe that may have benefited me a little bit. And that's why I feel that the associates are in a good position, because they don't have this worry about staff, especially now. Recruiting staff is a nightmare. And, if someone's off for COVID or not, it's just, I feel that right now, it's a privilege to be an associate. And if you're an associate, you're in a best position really to learn the skills and improve and hone it before you buy your own practice. So you are really set that when any patient comes through your practice, that you can deal with them. And I think for me, being an associate was a blessing, really. And I'm glad I didn't buy the practice till yet. Yeah.
Okay, my mistake. I thought you owned a dental practice. Okay, let's flip this question on its head then. In that case, why is it? Now, you've already summarized this just now. I know that, you want to remain an associate, etc. What would you say? There'll be people out there who want to buy practice because they think it's their only path to wealth.
Yeah.
That is such a misconception. That is 100%. A massive misconception. There are so many avenues open to you. And just like what we were saying earlier, you don't know what you don't know. So you yourself, Dev, you've invested money in growing. I know that you don't have a practice, but you have got other businesses simmering on the side. What other potential avenues are open to those associates who feel like they're very blinkered and that their only path to success and wealth is owning a dental practice? What other options do they have that they're not seeing?
I feel that it depends. I'm a quite clinical person, so I never was interested in owning a practice. I never say never, so maybe one day, maybe who knows. But maybe if I'm opening a teaching institute, that's different, because teaching is my passion. And with regards to the dentists who feel that owning the practice is the only way to progress in the career, I would certainly say yes, it's one of the way to do that, because you can then leverage, right? So you can leverage other dentists, other people, and you can get progress more. But as you were saying in your last podcast, right? So there are three ways of leveraging, and one of the way is educating, creating content. So if you're an associate and if you have got that skill, then you can use your remuneration, whatever you have, knowledge or money, because I would consider knowledge as a remuneration as well. Because when you work, when you gather all this knowledge, you come up with your own idea and your own knowledge. So it's quite bespoke to you. So when you have this knowledge and remuneration, you can then invest that into other pots. So, money, you can, you're doing amazing job in helping dentists in, investing into different sources, but Bitcoin or any other financial sources. Education, if your knowledge of education, then you can educate other dentists and, do what you love. So rather than owning the practice. And I've seen a lot of people who are successful associates, and it's growing. The number is growing because running a practice it's hard work, especially nowadays. So, but practice owners will not go back and become associates. So it's both. They both love what they do. But I personally feel that just because you're an associate doesn't mean that you're limited in your capabilities, and you can certainly invest in other sources to generate income. But I feel that you're more flexible because you can do other things. Whereas if you're a practice owner, then you're quite focused into one business.
Here's the thing. There'll be lots of people out there listening today who genuinely have a massive passion for being a principal dentist, and that's totally fine. There'll be people out there who have no interest in being a principal dentist, which is also totally fine. But then there'll be a group of people in the middle who feel like they want to push themselves to excel insofar as they become more financially successful. And they genuinely feel like being a principal dentist is the only means to do that. I know for a fact there are people out there like that. And we're speaking to the people in the middle that, perhaps some of those people will be the correct people to be a principal dentist, but actually it's worth exploring these other options before you maybe take on a huge amount of debt to get a practice, because there's no way, once you've got that, you're locked in effectively, or it's going to certainly be difficult to get rid of. So those are the people that we're speaking to. Those are the people that I like to speak to as well. And I just say, you know what, because that's part of the message of Dentists Who Invest, where I say, actually guys, there's other ways that you can do this if you wish to. And those three methods of leverage that you were talking about earlier, Dev, just for anybody who's listening, it's the human method, the cash method, and also the content method. And basically, I could spend about 20 minutes explaining those. It's probably a little bit more time than what we've got for today. But basically, if you want to become wealthy, you have to pick one of those three methods. And it's worth knowing what they are so that you can be educated and know which path that you're on. Because if the path that you're on misaligns with your goals and what you enjoy in life, then, well, that's not so fun. And life's about being excited and having fun along the way, because you don't get this time back and there's no rehearsals, which is a brilliant way of drawing a line under everything that we've just said.
Yeah, 100%. And as I said, and I echo you really, if you're an associate and you feel that you must buy a practice, I don't think that's, there are so many ways to become independent without buying a practice and enjoy your life. I mean, you don't have to buy a practice to be successful.
And actually, something's just popped into my head as well. I actually shot a podcast, a little bit of content with Andrew Acton not terribly long ago. From off the top of my head, I think it was about 4 or 5 episodes ago. And it was called Is Owning a Dental Practice for Me? So that's definitely worth checking out, anybody who's teetering on the brink about making that decision. Dev, you have, on the topic of leveraging yourself via media, you hinted at this just a minute ago. You've got your Facebook group, which is centered around dentists who want to become better at full mouth rehabs. And this is something that actually a lot. I don't think is actually taught well enough by anybody out there who's running courses at the minute. I genuinely think that. I genuinely think there's a big gap in the market to improve on that. I know that there are courses in my experience that teach the theory, but like we were talking earlier about dentistry, there's so much more depth to it and there's so much value in having mentorship on it, which is something I believe definitely could be improved on in this country. That's what your group is addressing, and it'll be interesting to hear a little bit more about that because I think I'm going to join.
Oh, thank you, James. Thanks for again kind words. So I actually created pathway to full mouth reconstruction because I had a I was a VT trainer for one of the dentists, and after she finished training with me, within a year, she started doing full mouth reconstruction. And I just felt that, if she can do it, why not everyone else is doing it? Because ultimately, there are enough patients to go around. I think what's happening is because dentists are um, overwhelmed from the system, but also they're underconfident that they cannot do full mouth reconstruction. Lots of patients are not being treated properly. And my aim is to really make sure that patient gets good care. But at the same time, by doing full mouth reconstruction, it's different. The satisfaction you get, your job satisfaction you get by doing full mouth reconstruction is completely different than just doing one class one restoration. And you many times you change people's lives, and that's what gets me. So I was thinking about that, and I created a full mouth reconstruction pathway. The pathway is because I again echo you as well that I didn't see any program because there are lots of implant programs where there is mentoring available, where implantologists will come to your practice, and I did that as well. I do implant. I did implant mentoring as well for a lot of dentists, and I used to go there and help them out. But there is no mentoring for restorative dentistry.
Totally agree.
So I created a pathway where there is an online course on full mouth reconstruction. If someone's done an online course, which all the contents for adhesive, direct full mouth reconstructions in there. If someone's done that course and they say, look, you know what, this is good, I can do full mouth reconstruction, that's great. If someone's done that course and then they are like, oh no, I need a little bit more information specific to my for my sort of situation, then I do hands-on course where they would come and we'll do hands-on practical for 6 days, various things, occlusion and mounting and bonding and everything related to full mouth reconstruction. And I will then take them through one-to-one case discussion of their cases, because again there are a lot of courses where the material's been delivered and then there is no support afterwards. Yes, there are WhatsApp groups, but that's not it. You need one-to-one support. And that's what I provide after hands-on course. And then let's say someone's planned the case, they're still not confident that this is my first case, I want someone to come to my practice. Then I would go to that practice and get them through doing that first case. So the plan is whoever comes out this whole system, they will come out in various levels, but they will come out becoming a full mouth reconstructive dentist. And to help people who are not in the haven't done the course or can't do the course for some reason or the other, I've created a Facebook group called Full Mouth Reconstruction for GDPs, where I'm putting on free information for people to improve their knowledge of full mouth reconstruction. I mean, it's very difficult to teach from full mouth reconstruction on a Facebook group, but I'm adding information and content, so it helps, and it sort of keeps the thinking going of dentists, and hopefully, if not with me, they will do some other courses and help themselves to do this full mouth reconstruction. Because I mean, if you imagine if you're doing 10 crowns on 10 different patients, or you're doing 10 crowns on the same patient, the effort is less because you're communicating with just one patient, you're seeing just one patient. And this is another way to obviously increase your remuneration, as we were talking about. So, and use that as an investment.
Awesome. So yeah, and I 110% agree. There's so many implant tutors out there, and they're good. You know, there's nothing wrong with if that's what you do. Absolutely nothing wrong. But definitely full mouth rehab, one-to-one mentorship is essential, and for some reason people just aren't doing it. And it always was something that interested me a lot. So for anybody out there who's a budding full mouth rehab dentist, or even somebody who's really into it, 110% check that group out, because to my knowledge it is unique. Dev, you have been so generous with your time today, sharing your wisdom, knowledge, and experience. Is there anything that you'd like to say in conclusion to wrap things up?
No, just last word, get investing.
I love it. Nice and succinct. Nailed it. Dev, it's been a pleasure to have you on the Dentist Who Invest podcast today. I'm looking forward to catching up with you very soon, my friend. I'll see you
Thank
later.
you for inviting me.
My pleasure.